Hey you guys, welcome back to Leah's Vlog. I'm so glad you have tuned into my channel. So today I want to dedicate this video to new nurses. It's just simply 5 tips that I personally use to help me get to this point in my career and be helpful for you. So let's get into the video. So I've been a nurse for about 2 years and I am still learning. I do not know everything, but I want to share what has basically helped me get to this point. And these are 5 tips that I recommend that new nurses apply to your journey in nursing in order to be an experienced nurse. So the first tip is to simply be yourself. Be yourself. Do not be like anyone else. I remember there was a person that I just gravitated to when I was living in Cleveland, Ohio, and she gave me this advice in regards to another aspect of my life because I am a pastor's wife, and she told me just to be myself, and I have carried that advice through every aspect of my life. And I know that when I started nursing, I was kind of hard on myself because I didn't have anyone in my family who was in the nursing field or in the medical field, so it took me a little bit longer to understand things. And I remember being on the floor and I would see other people, the skills that I wasn't experienced in, they were experienced in, and I would sometimes beat myself up, and I would feel like, man, do I even belong here? And I used to do that a lot, to the point where sometimes I'm just like, man, do I even belong here? But it's something clicked in me, and I remember what this person told me, and she simply said to be myself. And through time, I started to receive like compliments from my co-workers and from my patients that were basically highlighting the other areas that I was good in. Like empathy and compassion and patience. And so those were the things that kind of helped me get past that, and I started to realize what my strong suits were. And I think that's important to know, that you're not going to always do something well, but you should just remember to be who you are meant to be, because that is very freeing and that gives you confidence in who you are. And your patient needs you. They don't need anyone else. They need your compassion, they need your patience, they need your love, they need you. They don't need you to be like Sally Mae or Susie Q. They need you to be you. So that's tip number 1, is to simply be yourself. So tip number 2 is to ask questions. So again, as a new nurse, you have already passed the NCLEX, you have basically went through residency, or you're going through residency or orientation, and then you're on the floor now. And there are a lot of things that you did not get a chance to see in nursing school or while you were doing clinicals. And one thing that I have always kept at the forefront is that I do not know everything. I have enough basic knowledge in order to take care of my patients, but I do not know everything. And so a lot of times I would get to some scenarios where I was like, man, I'm kind of stumped. I don't know how to navigate through this. I didn't want to call a doctor, of course. Sometimes I didn't want to go to the charge nurse or whatever, but I had to take myself out of that and realize, if my question is the difference between a patient living and dying, I'm going to ask that question. So I embedded in my mind that no question is a dumb question, because a lot of times the questions that I did have when I went to experienced nurses, they didn't know as well. So as a new nurse, ask questions, get on your preceptor's nerves, get on your charge nurse nerves. I used to always reach out to my nursing educator. Like, I would send her emails like they were text messages, because I wanted to know exactly what I wanted to know everything I should know in order to take care of my patients the best way I could. So ask questions. No question is a dumb. Continue to ask questions and continue to get on everyone's nerves. Who cares? All right, so the third tip that I use in my journey is to observe experienced nurses. Again, as I stated previously, you're not going to know everything. You did not see all of the skills that you should see, especially if you are in a specialized unit right now. So what I would do is, if I would overhear another nurse say, yo, I'm about to go in and do a Foley, oh Leah, I'm about to use a Q-Day tip in order to insert a Foley, which I did not see when I was in nursing school, I would be like, oh, let me go and see, or whatever it was, a PICC line being in place, a PICC line dressing, a central line dressing, anything. It could be simple as just watching someone do a wet to dry dressing. Some nurses, you know, nursing students have not seen that. So if you see that or hear, so if you hear that an experienced nurse is actually going in to do a procedure that you have not seen and that you don't feel confident doing in your on your own, go in and ask, can you observe doing the procedure? And then also, it makes you a better nurse when you reach out to learn something that you don't know. Tip number 4 is basically just to bond with your coworkers. So I'm gonna be real, I consider myself fairly introverted. I do not, you know, talk unless I have something really to say. I don't like small talk, but I have learned nursing a lot of times when you're a floor nurse and you're in an acute care setting, you have a lot of things coming and going. Sometimes you have to discharge patients need to go, that are being discharged need to meet their rides, and then you have people coming in. You sometimes get to a point in nursing, if you're on the floor, where it's like you feel overwhelmed. You wish you had a clone or some little kids or somebody to help you, or another set of hands to help you accomplish all the tasks that you have to accomplish within this short span of time. And there's times where I have felt overwhelmed. So I've made it my goal that when I come in, of course, just to greet everyone, find something, a commonality between you and another coworker, and it doesn't have to be fake. Just create genuine a bond with your coworkers, because they are the ones that are going to bail you out when you're overwhelmed and when you just need help, and you don't want it to be awkward where you came in for a shift and you didn't speak to the fellow nurse that was, you know, sitting in front of you or at a computer. So say hello to your coworkers during lunch. Try to, you know, bond with them, find out what they like, but make it genuine, because they are the ones that are going to bail you out, and you're going to need them, and they will need you. So not only seek for them to bail you out, but when they need help, bail them out as well. Last tip is tip number 5. Tip number 5 is to simply invest in continual education. So as nurses, you know that you're going through residency, you're going through orientation, you have all these modules that you have to do, and you're like, I'm just tired of learning, I'm tired of modules, I'm tired of this. But you need to basically have this mentality where you're always learning something, because you're in a medical field, you're in nursing, things are always changing, and you need to be on top of things. So me personally, if I come up against a patient who's been diagnosed with something that I can't readily remember, the risk factors, the symptoms, I make a note of it, and when I go home, I basically look it up as if I'm in nursing school, and I try to retain that information so that the next time I have a patient, that I can be more knowledgeable and able to help. So, and not only that, but a lot of times I love YouTube. That's why I'm on YouTube. But I actually follow nurses who are in a specific field, or who had a patient or a video that is in line to what I need to learn. And I also utilize a lot of websites, and I listen to podcasts that are nursing related, and that actually deal with some things that I am not competent in, or I can't readily remember, so that I'm always, even on a weekly basis, trying to learn something new so that I can be a better nurse. Do not ever have the attitude where you feel like you can't learn. Always be in a learning state as a nurse, because that will make you only a better nurse. So I hope you're having a great week. If you had a bad day, shake it off. It's okay. Go get your nails done, go get your hair did, and, you know, get back into the groove and put a smile on your face. And when you come back for that next shift, be the best nurse that you can be to your patients. All right, if you have not subscribed to my channel, do me a favor and hit that subscribe button. And if you know any new nurses that could benefit from this page, share my page with them, and hit that bell for notification if you're already subscribed. All right, have a good day.